More than 4 billion people live across this vast continent called Asia, and we are telling their stories. On this edition, how China and South Korea managed to slow the spread of COVID-19, and life in one of Wuhan's shelter hospitals. I'm Wang Mangmang, and this is Assignment Asia. Countries can no longer avoid the spread of COVID-19, but they can slow it down to allow the healthcare system to cope. Here's how China and South Korea did it.
I'm deeply concerned about the rapid escalation and global spread of infection.
COVID-19 has spread to over 200 countries and regions, forcing governments to resort to drastic measures.
Un'Italia zona protetta.
Todo nuestro país, en toda España.
A national emergency.
Temporary restriction on.
संपूर्ण लॉकडाउन होने जा रहा.
Go home and stay home.
More than a third of the world's population is under some form of lockdown, with their movement and travel restricted in varying degrees. The measures vary, but the purpose is the same: to slow the spread of the highly infectious virus. One of the strictest lockdowns so far was the first, the lockdown of Wuhan, the epicenter of the outbreak in China.
Wuhan is the city at the center of the coronavirus outbreak.
The city has suspended public transport as well as
suspends public transport and outbound travel.
Zhang Guang, one of China's top epidemiologists, was sent to Wuhan in January to investigate the outbreak.
我们提出建议的时候，那时候是1月20号，那时候提出建议的时候，全国的病例那时候实际上是就300多，3天以后就被惨淡下去，全国600多，武汉是500多。可是从现在来看的话呢，确实是这个建议的话呢，能够那时候提出来是很不容易的。为什么那时候正好是春节以前的这个春运？我们非常担心春运可能把这病毒带到各处去。
中国山东航空公司 SC。
2 days before Chinese New Year's Day, China imposed the largest quarantine in history. First in the city of Wuhan, then the entire province of Hubei, affecting over 45 million people. Later in February, Chinese researchers calculated that if this quarantine was delayed by 5 days, the total number of cases in China would have tripled. A lockdown can easily backfire, but it didn't. Thanks to 580,000 community workers in Wuhan mobilized to help residents.
我们社区有2134户，3466人，老年人居多，全体来上的。
独居啊，然后还有空巢啊这样的老人的话，我们手上都会有一份名单，是每天要特定的要问一下的。孩子不在这里，然后他们就加我的微信，在微信上面跟我说要买什么。小李，我小姚，您接一下，慢一点啊。好，这边买了就要送过来，慢一点在家，有什么问题跟姑娘讲啊。
发热的病人他们要送，孤寡老人的药啊、粮食呀、菜呀，他们都得送上门。在这战争当中，我们能够尽点什么力呢？他能够理解他们，能够跟他们帮点忙是最好。
When the outbreak worsened in Wuhan, some residents were not even allowed to leave their compound.
We lock down, the concept will be going to the community setting. So keep at home and to avoid to contact other people and not attending the meeting and not attending the banquet. That's very important.
Zhong Nanshan, a respiratory scientist, is leading China's COVID-19 team of experts.
In China, we choose suppression. So do our best as far as better. So trying to make this occurrence, the incidence, to the minimum. And then nobody can stop the spreading or stop the infection of this kind of disease. But we can try to do our best to inhibit the spreading.
Back then, many questioned the effectiveness and the necessity of such restrictions. But today, experts like Dr. Anthony Fauci, a key health advisor in the Trump administration's coronavirus task force, believe it made a difference.
Their efforts have been draconian, something we never would be able to do here. But even though there's a lot of things that have unintended negative consequences of that, I think it did help dampen what would have been a broader Chinese. Wuhan was terrible, but I think they prevented a broader spread.
According to this study, Wuhan's quarantine only delayed the outbreak's progression in the Chinese mainland by 3 to 5 days. But at the international level, the number of imported cases from China was reduced by nearly 80% till mid-February.
We're encouraged that the steps China has taken to contain the outbreak at its source appear to have bought the world time, even though those steps have come at greater cost to China itself, but it's slowing the spread to the rest of the world.
如果要是一个弹钢琴的话，它是一个不常弹到的一个键。我觉得当这个威胁到的时候，我们公共卫生的话，专家更容易体会到它的危险性，是吧？这时我们就要提醒官员，你这个键你该弹了，而且你要重音弹呐。
We have a simple message for all countries: test, test, test. Test every suspected case. If they test positive, isolate them and find out who they have been in close contact with up to 2 days before they developed symptoms, and test those people too.
Test, test, test. That's exactly what South Korea did. In early February, when they had less than 20 cases, they were mass-producing test kits, which were sent to regional health centers. By the middle of February, when cases spiked in the city of Daegu and made it their worst-hit city, they were more than ready to test for potential cases. And they made it easy.
아무래도 다른 사람하고 접촉을 안 하게 되니까 차 안에 있으니까 그것 때문에 일로 오게 된 것 같아요.
10 minutes is all it takes, and the results are usually out within hours. The test is also free for all suspected cases.
짧은 시간에 많은 사람을 진단할 수 있기 때문에 저희들이 코로나 바이러스를 효율적으로 컨트롤할 수 있을 것 같습니다.
Across the country, there are 50 drive-through testing facilities and 600 testing centers designed to screen as many people as quickly as possible. A nation of 50 million, South Korea has tested 1 out of every 100 citizens, the highest testing rate in the world. Once ranked second worldwide in confirmed cases, South Korea managed to flatten the curve, slowing the virus's spread so that fewer people need to seek treatment at any given time.
它控制结果的是造成一种低流行状态，是持续的，但低流行状态也是不稳定的。你比如韩国和日本都不稳定，它控制到什么一种程度呢？我说它也是比较成功的，它医院的话能够容忍的程度。比如说我的病人的话出院了，腾出床位让新感染的人不断进来，形成个动态的，是吧？我不造成太大的压力。
The faster the infection curve rises, the faster the local healthcare system gets overloaded. Hospitals will struggle to treat a sudden surge in patients. In a flatter curve, the same number of people could be infected, but over a longer period of time, allowing the healthcare system to cope. When Wuhan was locked down on January 23rd, only 4 countries, the United States, Thailand, Japan, and South Korea, reported 7 cases altogether. 1 month later, on February 21st, when cases in China plateaued, the number of cases outside China hit 1,200.
What I believe is the window of opportunity is still there. But where our window of opportunity is narrowing, I would put it that way, narrowing.
More countries started seeing more than 100 cases. Authorities tightened their reins, but the virus seemed unstoppable.
That COVID-19 can be characterized as a pandemic.
By April 7th, 1.2 million people outside China were infected. In less than 2 months, the number grew by 1,000 times. While some countries are dealing with the first wave of infections, others are guarding against a second wave, like Singapore. For 3 months, it has managed to keep cases below 1,000. But there were signs of the outbreak worsening. So in early April, the city-state announced stricter measures.
We have decided that instead of tightening incrementally over the next few weeks, we should make a decisive move now to preempt escalating infections. We will close most workplaces, except for essential services and key economic sectors.
Zhang Guang is confident that China is now better prepared to deal with a potential second wave.
让它可能烧1棵树，烧几棵树，绝不可能烧一片树林，更不会引起森林大火。不能控制的，不可能。这是中国的话，老百姓都，是吧？从这个政府到我们公共卫生监测系统，是吧？到群众的话，这个素养都在这盯着呢。不管是外来的还是内部产生的。 关键的话，你有这个监测能力了，是吧？你能够及时识别了，就能扑灭。
Whether it's a lockdown or extensive testing, an effective public health measure is the one that has the people's support. When the government and the people work in tandem, this partnership will serve to buy time for hospitals to treat patients, for authorities to come up with coping mechanisms, for researchers to develop vaccines, and most importantly, to lessen the impact on vulnerable countries. While the virus can no longer be avoided, with proper and timely measures, the number of casualties can be reduced.
Up next, to cope with the deluge of patients in Wuhan, places like sports centers were converted into temporary or shelter hospitals for those with mild symptoms. One patient shows us what life inside was like. Imagine this. You've got COVID-19 and you're sent to a temporary or shelter hospital where you spend 22 days recovering with hundreds of other patients. What would you do to pass time? One patient, Yang Jing, decided to document her journey. Here's her story.
等待一朵花开，需要很多耐心和微笑。
我走啦，拜拜，你们好好保重啊，加油啊！
我用了22天的时间，等到了身体康复，等到了走去方舱医院。
On March the 4th, Yang Jing walked out of a shelter hospital, where she had been living with a group of strangers.
我是1月22号开始发烧的，烧得不高，但是眼睛蛮疼。第2天，武汉市管控，妈妈也开始发烧了，恶心呕吐。 2天之后，爸爸开始全身酸疼，又过了3天，爸爸也开始发烧。在方舱医院，我经历了蛮多，也记录了蛮多，但是还有蛮多的疑问，我想把我知道的故事留下来。
Yongjing began her life in the mobile shelter hospital 22 days earlier.
我现在终于上车了，这不是后湖大道吗？刚刚路过我的，我等下要被送到哪里去啊？去的地方是么样子的呀？哎，都不知道。
The Wuhan National Fitness Center is 4 kilometers from Yongjing's home and will now become the 7th shelter hospital in Wuhan.
还发了一个小台灯，还有接线板，还有拖鞋，啊，水壶，还有眼罩。是我自己戴的眼罩，舒服些，软一些。晚上还要戴口罩睡觉，憋死我了。 空调开得还蛮暖和啊，被窝也有一床薄的一床厚的，都是新的。在这个兜里，男女有分隔区，门板隔开，床和床之间的距离最少1米，这比我想象的要好太多了。
The Jiang'an District Shelter Hospital is divided into 3 zones and has 1,000 beds for diagnosed COVID-19 patients with mild symptoms.
进入方舱之后，生活就变得很有规律。早上护士要来检测体温、测血压。
肯定会成功的，你肯定会好好的出院的，好不好？一定要坚强，加油！
这边还有一个阅览处，这衣服都挂在这个上面了，真是有才呀！应该是外面下雨的时候呢，就晒不了，就只能晒这个里边。小姐姐们又给我们发餐了，谢谢谢谢。你看我们今天是不是又是豪华晚餐呢？ 也不知道后勤保障是怎么能够做到的。武汉的冬天这么冷，为么是每天送来的饭菜都能够保持着温度呢？
In 20 minutes, 900 boxed meals will be sent from here to the Jiang'an District Shelter Hospital.
今天是这个，这是那个我们叫咸鱼、石斑鱼，还有虾啊，还有那个豆角、咸菜啊。我们每天的那个盒饭是有一个主菜，今天主要是蒙古牛肉面。
Jiang'an District Shelter Hospital has set up 100 mobile toilets outdoors and arranged for people to regularly clean and disinfect them.
每天就是这样循环，还有我们患者不停地上厕所，他们就不停地洗，不停地消毒。就都说是病毒，就是粪便呐，或者是尿液病毒会传染。你们就是担不担心自己也会被传染呢？
担心肯定是有的，那我们把生死置之度外，这跟他们医务人员呐，或是啥子事啊，自然前线的那些善心的人来比啊。
11 a.m. The cleaners from the 7 a.m. shift return to a nearby hotel for some rest. Because they work inside the hospital, they have to be isolated there. In Jiang'an District Shelter Hospital, a strike team formed by the vice squad of the Jiang'an branch of the Wuhan Public Security Bureau is in charge of security here. In their daily jobs, these police officers mainly deal with criminal cases. Now, their job is to maintain order in the hospital.
他们又要出动了，有什么闻到了烧焦的味道，赶紧去看一下。 是这个区域说有烧焦的味道吗？
就这个地方，就 这个情况放那个多了。
有没有异味儿？没有啊。
我跟警察小哥哥们查了半天，也没发现什么问题，但他们还是不放心，继续在场内巡逻。
这个吨位有点大呀，这尿不湿。
很明显是吧？
不是很明显，就是肯定里面穿的这个衣服
没有
很薄吧？
今天这件外面的衣服它有点大，它一直往起叠，你会认得。
嗯。太背气了啊！
好不舒服。
现在才知道那个小孩子为什么那个尿不湿要不停的哭啊闹的。
嗯，还有红屁股是吧？是的。
今天难得去太阳，核酸检测就被安排在了户外。
阿姨紧不紧张？
紧张。一点都不用紧张，又不疼，是吧？咱天天刷一下就解决了。但是我肯定要把标本给您取得特别好。
The Jiang'an District Shelter Hospital has been taken over by the Hubei Provincial Hospital of Integrated Chinese and Western Medicine. Treatment work is mainly done by 8 teams of 740 medical workers from Hubei, Tianjin, Jiangxi, Guangdong, Shanghai, and so on.
给你2朵花，承载我们的祝福，希望你早点出院。
好，谢谢。
身体恢复了，气泡喝走了，大妈们也开始了丰富的娱乐活动，瑜伽倒立呀，瞬间集结的广场舞也逐渐拉开了序幕。
阿姨又竖起了大拇指。
是的，行了，阿姨，谢谢阿姨。
这衣服是好逗啊，
是吧？
像那公主裙。
我就是这条街最靓的仔。
好搞笑啊，
是吧？
其实你们还是挺快活的啊，性格都很好。
如果说我们都心情都不好的话，我怎么给你们带来开心呢？是吧？这整个气氛都整个下来了。
儿子说了，他长大了也想做一个像妈妈一样为国家做贡献的人。
阿姨在旁边旁听都流泪了。
没事。
真的，你们是特别不容易。
别激动，没事的，一切都会过去了。
谢谢，比个心。
在方舱里，我虽然从不曾看清他们的脸，但我知道他们很多人孩子的名字。
The medical team from Hubei live in a hotel, 15 minutes drive away from the shelter hospital. Today, head nurse Ning Yanting has a day off. She gets a box of snacks for her teammates and bought a box of cookies online. She asks for some garbage bags, disposable toothbrushes, and toothpaste from the hotel. She's going to give them to a patient's child.
昨天晚上，杨晶告诉我，她说会让你去看看这个女同志，她是35岁。他家6口人被分在了6个隔离点，最小的孩子3岁，大一点的那个是9岁，被分在各个隔离点。
让我看一下小秋秋，让我看小秋秋，宝贝你在吃什么呀？
是薯片。
哦，给我吃一个好不好呀？啊，给我吃一个，你送给我一个啊，送给我吃一个。
As the whole family is infected, the 3-year-old child is staying in a quarantine hotel with his 17-year-old cousin. Without any living materials, all they can do is call his mother, who is being treated in the hospital. When Yongjing heard about this, she turned to the head nurse for help.
我说我想帮助你，我说怎么我能帮到你？他很拒绝，他说你们已经非常辛苦了，我不想给你们添麻烦。 聂志是吗？啊，我是那个方舱医院里的，然后我给你带了1件水啊，然后这是给你们买的零食，这是拿的垃圾袋。我跟你说一下，我跟你说的这个瓶子啊，这是我没买到那个冲奶瓶的那个奶瓶，就你拿这个杯子冲嘛，这种不是要喝牛奶的吗？嗯。
Ning Yanting's child is called Yi. Before coming to Wuhan, Ning took part in the fight against the novel coronavirus in Shijiazhuang, the capital of Hubei, and her child was sent to her mother's home. They haven't seen each other for more than 40 days.
加油！咦，妈妈写你的名字了，
好够亲呐！对，
跟谢谢。
依依肯定特别开心，
他特别希望我写他的名字。
Many medical workers, including Ning Yanting, write their children's names on their protective suits, take photos of them, then send the photos to their children. This way, the children will feel that they are fighting against the coronavirus with their parents.
哎，他给我写了一封信，就是用那种有时候带拼音呐、汉字一起写的。他说，那个妈妈，你为什么要去武汉？我说妈妈其实跟很多叔叔阿姨都一样，都是战士，现在需要去战场上。
我们在这里支援的有江西医疗队，有河北医疗队，然后来支援我们。
This is the last time Yongjing will be recording life in the shelter hospital. She has just been told that she will soon be discharged.
隔离不隔爱。我们昨天早上才刚刚学的这首手语的舞蹈，献给所有的白衣天使和在座的所有的朋友们。
送给你小星星，送你花一朵，你在我生命中太多的感动。
这一天真的来了，我心里五味杂陈，真的说不上来是个么滋味。
After 22 days here, Yongjing is discharged from the hospital. She is sent to a rehabilitation center, along with 39 other recovered patients, for a 14-day medical observation.
你看看那是谁？
妈妈。我以为。
Yongjing's mother was released from quarantine and returned home 5 days ago. Today, Yongjing needs a few things and a change of clothes.
告诉你妈妈，你现在状况怎么样？跟她说一下。
谢谢你们，谢谢你们啊！好好好，谢谢谢谢。
2天后，爸爸就解除隔离了。2周后，我也回家。那时候，花就真的开了。
Yangjing and her family are healed and reunited. The city of Wuhan is also starting to recover, with the lockdown lifted and all 16 shelter hospitals closed. That's all the time we have for this week. I'm Wang Mengmeng in Beijing. Thanks for watching and join us again on Assignment Asia. Follow us on social media to contribute stories or share your thoughts.